medicine now is called social determinants of health.
No, I'm not. See, that's another big word. You didn't have to hit me with that. You could have said something in a layman terminology.
Well, okay.
I thought you were going to say social media. And I was like, I know that word. But you said social, then you shift gears on me.
Determinants of health.
Absolutely.
These are conditions that actually contribute to the health disparities that we see African Americans experience. Mm-hmm. For an example, the first one that we talked about, food deserts. Mm-hmm. In the black community, there are a lot of food deserts.
It is.
By food deserts, I mean there's not a place within a mile that you can go and get some fresh produce. Did you know that there is a relationship between the number of McDonald's and other fast food restaurants and heart attacks in the African American community?
Really?
Where do we eat most of our food?
Fast foods.
We eat fast foods for breakfast, we eat fast foods for lunch, and we eat fast foods for dinner. Mm-hmm. People who eat those kinds of foods all the time, they have more heart attacks. Mm-hmm. Keep in mind, heart attacks, the number one cause of death in the African American community.
Number one. Wow.
Cause more sugar, cause more, well, back down in Charleston, we call them strokes. What y'all call them up here?
Strokes. We might have said a little bit more country. Y'all say stroke, we say stroke.
That's right.
You know, we ain't even put an S on it.
That's right.
Stroke. You know we have.
So those are some of the social determinants of health. The other social determinants of health is we are required to live in areas that are very crowded. And that's why COVID has spread so rapidly in our community. Absolutely. Because if you look at the places where we live, we are living on top of one another.
Absolutely.
It's very difficult to practice social distancing.
That's right. That's right.
Okay. So the medical community is now looking at the social determinants of health. A lot of African American communities, you see a lot of industry where the groundwater has been poisoned, mm-hmm. the air has been poisoned, mm-hmm. And so all of those are social determinants of health that affect our poor health outcome. Misconceptions of blood pressure.
Man, let me tell you, blood pressure is the silent black man killer. We have to watch blood pressure because I learned it shows no signs. You can just feeling just as good as you want to, and blood pressure is through the roof.
That's exactly right.
Am I right?
You're absolutely right. One of the things that African Americans, many African Americans don't realize is that the guidelines for blood pressure has changed.
Yes, it
has. It is no longer 140 over 90. If you're 140 over 90, that's high blood pressure. Mm-hmm. The new guideline is your blood pressure now needs to be lower than 130 over 80. Mm-hmm. Bruce, it is so common that when a young man comes into my office with his blood pressure being high, mm-hmm. the first thing I ask him, do you have a family history? The next thing I ask him, do you use drugs? And then I ask him, well, how much alcohol do you drink? If they say, well, you know, I drink a couple of beers a day and 2 6-pack on the weekend. But Bruce, that's a lot of beer.
That's a lot of beer. I know he's lying when he tell you that because I used to drink, and I used to drink 4 5 beers in an hour and then drink 3 4 cases over the weekend. So he talking about a 6-pack. He lying to you, doc. I used to drink like that, but I stopped 37 years ago.
Somebody will tell them, oh, all you need to do is just go to the gym and work out, and that'll make your blood pressure go down.
It's not going to do it. The gym is a helpmate, but it's not the cure.
Say that again, my brother.
The gym is the helpmate, but it's not the cure.
A lot of our young brothers don't understand that.
Because I used to drink, doc, I'm talking about, I used to get so drunk. My ex-wife used to say, it's going to be me or the alcohol. One of us has got to go. And I sure didn't miss it. I did.